Endometriosis diagnosis and treatment. That is the treatment and diagnosis of endometriosis. The first step for any woman to get a proper diagnosis for endometriosis is scheduling an appointment with a gynecologist. Going over the endometriosis symptoms with a doctor can be the first clue that she may indeed have this disease. Only then can a proper treatment plan be put in place to help manage the symptoms it causes. Endometriosis cause remains something of a medical mystery. There are a number of theories as to what causes this disease, but a definite diagnosis by medical researchers has yet to be found. It is estimated that there are over 70 million women worldwide who suffer from the symptoms of endometriosis, making it a modern epidemic. One issue that seems to be hindering the search for an endometriosis cause is the inability of researchers to track it on a global scale. Understanding the relationships between the environmental, social, and hereditary backgrounds of the women with endometriosis will seem to go a long way in determining a cause. Right now, there is still only speculative theories when it comes to determining endometriosis cause. The more notable and medically sound theories include retrograde menstruation, also known as the backflow theory. It was first formulated by Dr. John Sampson in 1921. This is kind of like a menstrual regurgitation in which some of the menstrual fluid is forced backwards into the fallopian tubes and into the abdominal cavity. While this does make a certain amount of sense, how else could endometrial cell get into the abdomen? There are a number of studies that seem to disprove this theory. Many women who experience this backflow do not develop endometriosis. Dr. Sampson's theory also fails to explain how many women exhibit endometrial cells in other parts of their body, such as the lungs, skin, lymph nodes, and breasts. It also does not explain the rare case when endometriosis is found in men. Genetic heredity. In many cases, endometriosis seems to run in families. This cause was first theorized back in 1943, and researchers continue to pursue this line of thought. It is known that women whose mother or sister has endometriosis are 6 times more likely to get the disease. The theory of transplantation. This theory of endometriosis cause is based on delivery through the lymphatic and circulatory system. This will explain endometrial cells that find their way to other parts of the body. Iatrogenic transplantation. This idea has been largely disproven, but it espoused the idea that endometriosis is spread through the body during surgery. This, of course, does nothing to explain endometriosis cause in women who have never had a surgery. Coelomic metaplasia. This is the mutated cell theory. It is thought that certain types of cells can transform into a different type of cell when properly stimulated. In this case, women undergoing estrogen replacement therapy or who have been exposed to environmental factors that increase estrogen levels. This theory may help explain why in rare cases men have been diagnosed with endometriosis. Xenostrogen. An interesting thing about endometriosis is the fact that up until 100 or so years ago, it was rather an uncommon medical disorder. Many people think it is epidemic, like increase is due to factors brought about by the industrial age we live in. Exposure to too many of the industrial products such as synthetic fertilizers, pesticides, and more importantly plastics has brought about a condition known as estrogen dominance. Estrogen is the primary food source for endometrial tissue, and most treatment regimens work to lower estrogen levels in women with endometriosis. If you are serious about knowing more on the diagnosis and treatment of endometriosis, make sure you check out this site right here. This site is helping thousands of people getting solution to overcome the problem of endometriosis. You can check it out instantly by clicking the link in my video below.